by their own head doctors, and that should really happen. So if an endocrinologist is working with the patients and see that he could have all the requirements for the surgery, should tell him you should get the surgery. This is a very beneficial for you. There are some of them that not all the diabetic patients should have the surgery, but there's a large group of patients that they should have the treatment, because getting off the medication is going to be better than having the medication and all the complications of the medication, because every medication that you have is a foreign or something unnatural for the body. And so what we're trying to supply what the body should do, and that's something that the patient should be aware.
Basically, to sum it up if I can, you're pretty pleased with what you see as a result of the surgery.
Yes.
And the success rate is exceptional.
It's very good. When you met the requirements as a patient, even though we're going to do surgery in the patient shouldn't leave their head doctors. They should still keep with the head doctors, because this is a person who's going to do follow-up in all the requirements that we want after the surgery. Vitamin levels, iron levels, see how the insulin production is, peptide C levels, and all these things. So it's not that you're getting off your head doctor, but you're getting off of all these illness that you could have because of diabetes.
So you would certainly recommend this type of surgery. Is there a profile of a good candidate, and opposite of that, are there profiles where people are not candidates? Something we can
yes, summarize candidates or requirements for surgery should be a patient that isn't above 65 years old and shouldn't have below 18 years old. It has to be type 2 diabetes. It shouldn't be type 1. HB1AC above 7.0. 2 or more treatments of diabetes. It doesn't matter if it's insulin or it's orally medication. And a peptide C above 3. That's usually the requirements that we want for a patient.
If someone is older, for instance, I have a friend who's 74, he's in good condition, he's got good levels of, his blood work is good, he doesn't have a heart condition, but he's 74, he's on metformin. Would he not be an ideal or
no? It's not an ideal. It's a singular case, so we need to look at it as any other, because we could have a patient that is 60 and looks like 80, and it isn't very good candidate for surgery. So it depends on the health of the patient and how the long term of the diabetes. More than 12 years, they don't have a very good percent of resolution, and we want patients to get the surgery, but they could have success on the treatment of diabetes.
And I imagine patients with cardiac problems or things like that would be...
It depends. For example, if they are stable and the cardiologist says that they could have surgery and there's no immediate risk but if you have, for example, a patient who has a dilated heart and is in anticoagulant and he has a neuropathy and all these things, it's not the best candidate, because it's a very good surgery for the patient, but not to do here in Costa Rica. Because you have to be aware that you're going to a foreign country and you want for the surgery to be a success 100%. And those things could jeopardize that success. But most of the patients are not like that. 80%, 90% of the patients, they are very good health, and they have been in follow-up for the diabetes, and they actually could be a very good candidate for surgery.
And maybe something... the program here in Costa Rica, there's a nutritionist, there's a psychological evaluation. Maybe you can talk.
Yeah, we do everything, all the requirements that we do is with the ASMBS and the IFSO, that is the International Federation for Surgery of Obesity. And we do exactly the same what we ask, but we do it, for example, in one day. These patients usually comes and they have all the schedule, and before they go into any surgery, they go into endoscopy, upper endoscopy, they go into blood tests. They do a psychological evaluation, they do a nutritional evaluation, and they do also an internal medicine preoperative evaluation. So that means that a specialty doctor is going to take an exam, do an EKG, look at the test, and see if that he's medically up to date to do the surgery. And everything is done in one day, and then after that, after all these things, he will talk to me. We'll review the surgery again, and then the next day we'll have the surgery.
Do they spend the night in the hospital?
They spend one night on the hospital, and then after that, they usually go into a recovery hotel that already we have agreements with them to how to handle nutrition and all these things, and we also have a nurse that they look for the patient every day to see how's everything, the blood sugar levels, how he's feeling, how he's tolerating the surgery, and all these things.
And the nutritionist follows up with the patient regularly.
And the nutritionist has a video conference with the patient 1 year after the surgery, 6 times in a year, so it can actually knows or get knowledge on how to handle better the nutrition after the surgery.
So basically, for our requirements, if you are a candidate, a good candidate, you would recommend the surgery 100%.
Yes, I will recommend it.
Here's the questions. What BMI can you expect post-surgery?
Okay, it depends on the BMI of the patient. Usually, when we do the surgery, there's an average between probably 15 to 20 pounds to lose in the first year. And then after that, they will regain about 50% of what they lost, but that's going to be there. If we see a patient that is a little bit bigger in BMI and is more obese, so we'll do the more restrictional surgery so he can lose weight and maintain the weight off.
And do you consider that the surgery is a last resort?
Yes, it is the last result in a way that the patient is doing everything that he can for the diabetes and is not resolving very good. It doesn't have a very good success. I think that he is a very good candidate for surgery.
Okay. What is the criteria for gastric bypass surgery? Is it 100 pounds overweight?
No, that's an old factor or requirement that we used to have. Now we have the BMI, so we make a classification through the BMI. So everything that is above 35 and an illness, or everything above 40 should have obesity surgery. Everything below that is metabolic surgery.
So what are the qualifications to be a patient for bypass surgery?
Bypass as a metabolic surgery, like we said, BMI below 34, HB1AC is above 7.0, 2 or more treatments, less than 10 years of diabetes, and the BMI and the ages, that shouldn't be between 18 and 60, 65.
And maybe about your experience with the surgery, how long you've been doing it. You've been working with a lot of patients from the United States.
We've been working with this kind of surgery a long time now, probably around 15 years. And we have a very good success. Our percent of resolution for diabetes is almost 93%, so it's really good. But with very good patients, they have the surgery is not like the main thing of the surgery is what the patient does after the surgery, with the help of us and the nutritionists, all these things. We have worked with medical tours almost 10 years now, and we have very good success with patients from the U.S. And they also keep following with everything. They send me blood tests, they send me reports, and see how they actually has done with the surgery of the diabetes.
Well, I really appreciate your time, Dr. Zafrani, and we look forward to curing diabetes as much as we can. My goal is 100% no more drugs for diabetes.
Okay.
So, but just don't tell Big Pharma because they'll come and get me. Thank you so much for your time.
My pleasure.